Hey everybody, welcome to Ask Dr. Testosterone, starring Dr. George Toulianos, brought to you by his books, Bodybuilding, the Good, the Bad, and the Ugly. Really good primer on all types of PEDs that are used in the sport, doses, side effects, cycles, things like that. Then the follow-up, training, nutrition, supplementation in bodybuilding, so you can put all that together and get the best physique possible. And if you're on Amazon, you might as well get my book. What a great book, Real Bodybuilding, 25 years of truth, blah, 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 blah. Now, from Athens, Greece, please welcome Dr. George Toulianos. George, what a week. What a week it's been. Since the last time I talked to you 1 week ago. Jeez. First of all, my condolences on your grandmother, George. Very sorry to hear she passed.
Thank you.
She was...
it was a hard moment for my life, because all my life I was raised by her, and 47 years she was like a second mother to me.
Yeah.
And of course she's over the average of the lifespan, but you never expect to lose your very close ones. And usually grandchildren with their grandparents, they have a special relationship. I would trust more my grandmother than my mother. Tell her more secrets, and feel safety. The same goes for my sister. Anyway, she struggled a lot, and we helped her the most we could.
Yeah.
It was something inevitable. It was something progressive. But I think now, because she was very religious, she is in a better place without pain.
Yeah.
Now, about me.
Hold on a second. How old was she? She was 107, 108?
108.
That's incredible. She lived through so much history, so much of the world's
she lived
history.
a full life, yes.
Yeah,
wow. A full life, and
yeah.
Memories were great, and she had 3 brothers, 3 children, 3 grandchildren, and 3 great-grandchildren,
Okay.
So it was to the fullest.
Cool.
And she left a great legacy, and I believe her blessing was that she lived so many years because she was fair. She was a fair person,
Yeah.
Anyway.
Now, what happened to you? Because we talked on Monday morning. You had an injury training. What was that? Yeah. The same day?
Actually, that injury, the day of the show, the last show on 109, I did the MRI, okay? And the day after, the MRI revealed a broken disc. It was not just a herniated disc. Okay? So
let everybody know. Let's back up. It happened while you were squatting at home, right?
I was squatting at home, a regular workout, leg workout, Friday evening. And I'm doing progressively the pyramid, okay? So I'm increasing the load. Yeah. So I go to 330 for 3 reps. At the second, all the way down parallel, of course. Now, on the second rep, I heard a pop. I had some attack like this. Yeah. And I was warm, and it didn't hurt that much because I was warm in the adrenaline, and the stress. But after a while, when I sat down and took a little breath for 2 minutes in order to go to the next set, it was crazy. I didn't stop. I felt a little bit of numbing. Okay. So I did another more rep, and then I went to 375 for 1 rep. And afterwards, I did the rest of the workout, and eventually I had the stupid idea to go for a walk for 30 minutes. That was it. After I sat down, I took some anti-inflammatory, but when I woke up, it was a horrible, the worst pain in my life ever. Wikipedia scales it 9 out of 10 of the most pain everything, Wow. So I almost fainted when I was taking a pee in the bathroom. I couldn't stand on my feet, I was standing on my one leg, I was screaming while I was taking a bath, from pain. I was taking 60 milligrams of codeine in order to sustain the pain, Yeah. I had horrible pain towards my fibula, to the head of the fibula and to the tibia, where the sciatic nerve device, spreads. So from the butt goes down to the hams, and then splits, to the head of the fibula, goes to the fibular nerve, and then anterior tibial nerve to the front of the tibia, Okay. So this was the spot where I had massive pain, just when I was lying in bed, Wow. So yes, we had an appointment on the public hospital where my brother-in-law works with MRI, and this revealed several bulging, protruding discs, but also 2 herniated out of 1 week, out of which one was broken. Now, I consulted the finest doctors, 2 very top neurosurgeons, one from Germany. I mean, he studied in Germany. Okay, he's a professor in Greece, and the other from Harvard in Boston. Oh, wow. They both told me, you don't need, it will heal progressively, blah, 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 etc. Yeah. Another 2 orthopedic surgeons told me the same. Actually, one is a sports medicine doctor that also helps me with my former sciatica when I had in 2018, Ron. I did also an MRI because I was doing heavy T-bar rolls, okay? And back then, 3 years ago, the MRI revealed several bulging discs, but not herniated, okay? So I stepped back and I stopped my T-bar rolls, but I bent over barbell rolls, you know. I quit from deadlifts. But, you know, during the quarantine, I pushed it to the limit. I made a new gym here, and I made some serious gains and some personal bests at the age of 47. Wow. But you have to know that my spine was already, you know, strained all those years, okay? And I was telling that, yeah, the other 2 also orthopedic surgeons told me that you don't need to do it. We will fix it, we will heal, blah, blah, blah. But the professor of orthopedics in Greece, who is actually a member of the Greek Academy, and he's super expert in the spinal cord, told me, by the lifestyle you're doing, he knows me since I was a medical student. He was my professor in orthopedics in the university, yes. He told me, by the lifestyle you're doing, and because those fragments of the disc are found in a special place called hippocratic sac, means they're gonna attach all those nerves, and in the long term, you're gonna have calcification, you know? Yeah. And some inability in order to move. And actually, I have to tell you that 20% of my left limb was unable to do abduction. And actually, the commonest side effect is not able to raise your ankle joint. Oh, your foot. You can't get your foot off the ground? Yeah. So tibialis anterior, not the gastrocnemius, the flex. Right. The opposite. Like when you go downhill, so you try to, yeah. Okay. All right? Yeah, got it. So this kind of operation, I hope it was precautiously in order to avoid the worst in the future, you know? And I have to tell you the best thing about it was the recuperation and the recovery, 0 pain now. Wow. I was able to do a little bit of walking, okay, low pace, and a little bit of just warming up, you know, dips, chin-ups, and have, very isolated my midsection in order to do a little bit of rows with my chest on the incline reverse, you know. Oh, I saw you doing that. I can't believe you're already you're working out so fast after you. I'm not running Coleman what he did, but I'm not even have broken discs, vertebra. But I'm doing very careful, isolated movement, just, sending the blood flow, nothing more, because the neurosurgeon told me, your spine, your muscles save your spine. Okay, your rectus spinae, your lower back muscles were able to hold you so tight in order to avoid you collapsing, you know? So what did they do in the surgery? What was done to you? So yes, it's decompression. That means they suck up like a vacuum cleaner all those fragments. Wow. And also they put you some gel of hyaluronic acid, the disc gel. But also they cut. So it's a microsurgical procedure with a microscope. They cut. I have an incision of, it's about 2 inches and 10 stitches, I think. And also they had to drain, they put me a tube that was drained fluid from the wound, 150 ml of blood that was kind of phlebotomy, I saw that. That was a lot. It looked like a lot of fluid. Yeah, it was yucky, yeah. But he told me that you have a high hematocrit. Yeah, I told him I'm using testosterone for replacement therapy and also nandrolone. Yeah. And I have to tell you, Ron, growth hormone saved my ass from recovery. Wow. Yeah, growth hormone, Deca, and testosterone saved my ass from, I'm able to stand here. I went to the office today. I went to the office, of course, the day before the surgery, but I believe that anabolic steroids help you tremendously in the rehabilitation process. Yeah, and you only do what, 2 IUs of growth a day? Yes. Wow, so that's enough.
That's really enough for like
a little bit of Deca, a little bit of testosterone. You know, I'm able to maintain my skeletal structure. You know, in order to avoid falling apart. Unfortunately, I have to adjust and forget about it, lifts and squats for quite some time. You know, and do very careful some movements in order to strengthen again my core and my lower back. But who could expect to recover so fast and be able to walk and work, you know?
Yeah. You're working out. You're working out again like 2 days later?
I mean, I'm just shedding a little bit of blood. It's not a regular workout.
Still. Most people would be like, they wouldn't do anything for like a month or 2 or 3 months.
Mostly I'm able to use the restroom, to take a shower, you know, these daily things that you take for granted, you know, and make you feel disabled and depressed. Right. If you're not able to do this, you know. I was able to go to my grandmother's funeral, you know.
Well, was that right after your surgery, like the day after?
Right after, yeah. Wow. The next afternoon, yes.
Wow.
Yeah.
Wow. Are the gyms open yet in Greece?
No.
No?
I think June.
What's taking so long? Come on.
You know, the cases are still expanding now, but it's a hard time. You know, it's a weird year, and I was at my best. You know, I was doing some good.
Dude, your arms were looking like, man, Doc's arms are looking jacked. Shoulders, arms, chest.
We are warriors. We fall and we rise again. You know, and the body dies when the spirit dies.
That's right. Yeah. Cool. All right. Want to get to some questions? Yeah. These people still got questions for you. Here's a good one. Dr. T, hello. I'm taking an over-the-counter test booster. How long should I stay on it? And should I cycle off of it? Test boosters.
No, test boosters, I suggest them to use them with PCT and pre-workout also. Double dose what is suggested on the
bottle.
On the bottle, yeah. You just don't cycle this. You just use them, you know, and you expect only perhaps some better sex drive, but not gains, because the elevation of the testosterone refers mainly to sex drive, perhaps some recovery, but do not expect gains, you know. This comes in the long term through diet and the classic process.
Yeah, I mean, I've never been I don't want to get any of the sponsors mad, but I've never been a fan of test boosters. You know, if you need a test boost, if your test is really low, get on a little bit of test. And if your test
this actually shut off your own production, but for people who are 100% natty and they don't want to touch anything artificial, you know, they can use them, but only in the level of sex drive, you know, and no massive gains, you know.
Yeah, nobody's getting jacked on test boosters. Sorry. Here's a good question about drug interactions. Doctor, is it a bad idea to stack NPP, nandrolone phenopropionate, with Trenbolone? Example, 500 milligrams testpropionate plus 250 NPP plus 150 Trenace per week.
No, those compounds are both 19-testosterone derivative with the progestational activity. So supposedly, because they're stacked also with an aromatizing agent like testosterone, they could elevate prolactin. So with this 0.5 gram of testosterone, you need at least 2 to 3 milligrams of anastrozole per week. Monday, Wednesday, Thursday, 1 milligram. So let's say precautiously we're using 1 milligram of cabergoline twice a week, perhaps with those two agents. It's better to check out first prolactin if it's elevated. Yes. So this is a good cycle, a good anabolic cycle, because both Deca and Tren are really good anabolics, plus testosterone, you know. It's a classic off-season.
I mean, if you're going to do that, would it make more sense to just do more nandrolone and no Tren and then switch over to Tren later with more Tren? Or would you say
stacking always is better, you know, but when you stack, you lower the doses one to the other, you know?
Yeah. Okay. Gotcha. Next one is, guy says, I'm 47 years old. I had a pituitary tumor that was producing IDGF-1.
IGF-1.
He means IGF-1. Yeah. Now I have osteoarthritis in my hips. Is there anything I can take to reduce the pain? Ouch.
Well, I guess replacement of the hip joint is the best.
Yeah, I mean, if they're that bad. Yeah.
Now, if you've heard that much, I suggest you take some Nubain or opiates, you know, I mean, these drugs they mask the pain tremendously well, but they don't heal the joint, you know. So when you mask the pain, you may continue your physical activity and make it worse, you know, actually. But I don't think also taking glucosamine hydrating will make better osteoarthritis. I mean, the hip replacement is something that is quite often after your 50s or 60s, you know?
Yeah. I mean, I know two people that, you know, Jose Raymond and his brother have both had their hips replaced in their 40s. And Tito, he's my age, he's 51 now. He runs, he does triathlons, he does CrossFit, he lifts crazy weights.
After that?
After, yeah. But, you know,
really?
But they're not regular human beings. They're like super athletes, that whole family.
Ronnie Coleman also had.
He had both hips replaced, yeah.
Okay.
But, Jose had a hip replaced 2 years ago, and he's
Tito was like a fitness competitor, you know, was very athletic.
Well, he was a lifetime natural. Tito never took any drugs. But,
really?
Really, yeah. I competed with him when we were kids in the natural organization. He looked great. When he was like 20 years old, I thought he was, not to the face, but I got really depressed when I found out we were the same age because he was so much more developed. He looked like a grown man, the body.
Jose's a beast. He's 212, I think. Competitor, I met him in Vegas.
Yeah. Well, Jose, you know, Tito could have been a great pro bodybuilder if he had wanted to, but he didn't want to use drugs. But yeah, hip replacement is something I think a lot of bodybuilders are going to have to eventually do when they're maybe over 50, because those hips don't get any better after all those years of squats, deadlifts, leg press, hack squat. It takes a toll. Okay. Yeah, this is a good question. You know, people always want to know if they're sick, if they should still keep taking their drugs. So this guy says, if you're sick, a high temperature, a flu, hopefully it's not COVID, sir, should you continue to take your testosterone dose or be better to discontinue it until you get better? He's doing 100 milligrams of test enanthate twice a week.
Well, usually when you are ill, you don't train, right? You don't feel good. So what's the point of taking something perhaps anti-catabolic? But on the other hand, if testosterone makes you feel sick because it's contaminated, stop it.
Yeah, but you know, if you're on TRT, you take your TRT every week.
Sure.
Regardless.
To be biologically active, yes.
So I don't know if if he's on TRT or he's just, that's his cycle. That's pretty small, a low dose.
If it's a replacement therapy, you don't stop it no matter what.
Gotcha. Okay. Sustanon questions. People love Sustanon still. Hi, for some reason, Sustanon is usually recommended to inject once a week or even every 5th day. But given it has long esters in it, like an undequinate, wouldn't it be a decent approach to inject 5 ml at once and expect to have high testosterone for approximately 20 days that the undequinate lasts?
Yes, this is a good point, actually. But we have to consider that Sustanon is a blend. So it's not like testosterone undequinate, Nebido, or Avid, which is purely only the undequinate ester. So Sustanon has also propionate that goes rapidly fast. So it has a fast acting that gets into the system and a slower undequinate that clears the system. So it's not a solid undequinate, but it's a mixture. So for this, because a part of it enters rapidly, it means that a part of it also will clear the system, and a smaller portion also will live lower. So I think we should follow the 5 or to 7 days rule. Yes, the frequency.
Let's think about that. If you did 5 ml of Sustanon at once, that's let me try that. 1,250 milligrams of testosterone you'd be injecting at one time. That's crazy. But what about Nebido? When they give Nebido for TRT in Europe, how much do they give at once?
1,000. That means 667.
Okay.
You know, because 60% is liberated. But this goes out progressively, you know. So it takes a while to elevate and spike, you know, and it's not good from, pharmacokinetics. You know, for people who are lazy with the injections, they just want to travel and rest, you know. And not so active people that they need when you are active and when you train, you just need to have a peak always, you know. So Nebido, there comes a time after a plateau that goes down, And because perhaps those people are not physically active, they don't feel this urge to have a spike.
Mm-hmm. Yeah. Yeah. I mean, they don't care if their levels go up and down like crazy.
Yes.
We do. Hello, doctor. This is a good one. What is the reason of feeling like vomiting during training? Is it organic problems or psychological problems? I'm not on any kind of steroids. Just had H. pylori for 1 month treatment, which was amoxicillin 2 grams a day and ciprofloxacin 500 milligrams and Emprazole 40 milligrams a day.
Omeprazole, yes.
So
now,
wow.
Personally, I have experienced the urge to vomit when I have an empty stomach and I train vigorously with weights. Also, you can vomit if you have just a meal, but who trains with a heavy stomach? You know, nobody does. But I remember Chris Cormier when training with Dorian. He puked, you know, outside the temple gym because it was super intensity, and I guess he had nothing to throw up because he trained on an empty stomach.
Right.
And actually, the vagus nerve, the pneumonogastric nerve, the 10th cranial nerve is stimulated that innervates the stomach, you know, and this is what it is irritated also in the diaphragm as well. And I believe it's very high intensity with an empty stomach. You feel nausea, and then you just have this reflex because vomiting is a reflex, you know?
Yeah. You're the only person I've ever seen that could eat a big meal and train was Evan Santapani. Because I used to go down to that gym, the Powerhouse gym, and he would eat, let's say 20 minutes, he would have a big piece of fish and there would be like either potato or rice.
Well, fish and potato are easy to digest. So
okay.
Mostly water, but not a steak, you know. And,
Lee Haney believes steak takes like 24 hours to digest or something.
Really?
Something completely digest. But yeah, Evan used to freak me out. We'd go down there, he would eat. 20 minutes later, he'd be under a squat rack or pulling a deadlift. I'm like, this guy's nuts.
I heard a story that Lee Haney ate so slowly that he was able to digest the food properly, you know, because when you eat so fast, it's not synchronized, the GIT tract with the brain. Right. Again, you don't have the satiety feeling, you know.
That's true. And you know what else I wonder about? You know, we produce the saliva that we produce when we eat. That has the enzymes in it that helps us digest
saliva,
the food.
Amylase enzyme is released just when carbs and starch enter the oral cavity. So if we eat a cookie, amylase is released from is released with saliva in order to break down the starch.
But if you eat really fast, you probably never have a chance. You don't make much saliva because you're just swallowing the food whole.
And if you eat really fast, you swallow air and you fart air.
I think that happens to me all the damn time. Oh boy. And I don't even eat fast. I think I just swallow a lot of air. Okay. Next one is, I've got some tests that I've injected twice now. And both times I had lumps for like 7 days and the injection site became warm. I did proper cleaning and hygiene with injecting. Could the test be contaminated? And he says it's from Triton Farm, but I don't know. We don't know all these underground labs.
Not necessarily, because these labs refer to the accumulated of oily solution. You know, even it's not contaminated, which means non-septic infection, it means that this abscess is made by too much of oil that is not spread out. Okay, so in its time, of course, he has to stop and forget about injecting that spot for a few weeks. I used to switch into orals when I had abscess in my both butts, and then I was injecting into my shoulders, you know. Yeah. And then you go in orals. You don't have any other options, Ron. You're like a junkie, you know.
You run out of places to stick the needle. Well, you know what I did a couple times was right there on the outside.
Yeah, if you have a lots like Dorian Yates or Ronnie Coleman, of course.
And you need help. I could never do that myself. I can't reach. My arms are too short. I need help. Thanks, Janet. Thanks, wife. Anyway, last question. How long after taking Deca can I start Finasteride and Rogaine? In other words, how long does it take for Deca to not be active and interfere with the Finasteride?
Now, I believe that Deca, as Connor said in the Anabolics book, does not metabolize to the hydrotestosterone, but to dihydronadrolone, which is less androgenic than DHT, the DHN. That's why Deca is supposed to be more friendly to the hair thinning rather than the DHT derivatives, you know, or other compounds like Trenbolone, for instance.
Yeah.
But Finasteride and Finasteride take a few weeks or months even to work, you know. At least they need to make a good level after, and they work after 6 months. I was told this by a hair transplant doctor who takes also Finasteride. So in order to establish a good environment of anti-androgens, the 5-reductase inhibitors, you need a few months to take them daily, you know?
Yeah.
You just don't on and off, go on and off.
But does Deca, if you're on Deca, would that interfere with the Finasteride working?
Certainly, Finasteride and Finasteride are able to break down the conversion of testosterone to DHT, and they are affected with testosterone. But I prefer to use Deca and testosterone rather than Deca with Proviron, Winstrol, Anavar, Winstrol, Anatrol, Dianabol, whatever else.
Yeah. So
DHN, I guess, is the only exception of anabolic steroid of Deca that does not produce dihydrotestosterone. So you have to check it yourself, you know.
Yeah, it's testing Deca. That's like peanut butter and jelly, as far as I'm concerned. If you can't grow on testing Deca, you know, because these kids are always messaging me, they want the perfect cycle. They're always looking for the perfect steroid cycle. I said, you know, about 20 million guys have gotten big on test, Deca, and D-ball. That's it. They didn't make it that complicated. It's not that complicated. You
had a show the other day, is that cycle is not the holy grail, what you said.
Yeah. Because I'm getting, I had some guy messaging me for a while asking me, what can I do? He was getting ready for a contest. And he said, what about Winstrol and Anavar? And he's asking all about different steroids and how to use them. And, you know,
combinations.
Yeah, and I'm not an expert. I told him the little bit that I know. But then I finally clicked on his picture, on his profile, and looked to see what he looked like. I'm like, oh my God, this guy looks like, I would never want anyone to get this fat like in the 30 weeks out from a contest. And he was like 8 or 9 weeks out. So, you know, they're looking for drugs to do magic.
Miraculous.
You can't let yourself get fat, guy. If you get really obese, fat, there's no Winstrol, there's no Anavar, not even, you could take.
Yeah, they believe that the magic pills that they're gonna, you know, melt the fat, which is something that does not happen. You know, you need to be lean in the off season, at least 10%. You know.
Yeah, it's hard, you know, because a lot of people love to eat crap. They love cookies, donuts, ice cream, cake. You know, I love all that stuff too, but I'm not going to eat it every day. You
plug your arteries with that, you know. You plug your arteries also with gear, but you don't need that shit in order to make it worse.
I mean,
and they're empty calories, you know, no useless calories to grow.
I mean, you know, we talk about the heart, but if you're eating a bunch of junk food and fast food all the time, and you're on steroids, and you're very overweight, dude, good luck. Good luck. You're like a walking you're a heart attack waiting to happen at that point. So that's all.
Of course, steroids take you to the next level, but they're not enough in order to make you a champion.
No, if they were.
Yeah, many people take steroids, few become champions and win, you know.
Where are all the big Ramis? Where are all the Brian Currys? I don't see them walking around everywhere, you know. Because like I go to a gym where there's a couple hundred guys at my gym on steroids, at least.
I believe at least perhaps 50% of people in the gym have tried once steroids. Yeah. 1 out of 2.
Sure. Cool. Well, that's the show, doctor. Again, condolences on your grandmother.
Thank you.
Glad to see your injury. You were able to get, you know, surgery, and you're already on the road to recovery. That's excellent to hear. But you know, I figured you'd be very smart. You'd get the best medical attention possible. Why wouldn't you? You're Dr. Testosterone, for God's sake. So, everybody, if you have questions for the doctor, please leave them in the comments here below. If you're not subscribed to the channel, please subscribe. Hit that little bell symbol so you're notified when we get new videos. We appreciate your viewership. This is a very, very unique opportunity we have with a medical doctor who's also a national bodybuilding champion, Dr. George here. It's you know, not many people get this chance to ask these type of questions to someone who actually knows the answer with medical knowledge to back it up. So, George, thank you so much for doing this show every week. And that's it, everybody. We appreciate you watching. This has been Ask Dr. Testosterone. We'll see you next time.